Hi everyone, welcome back to Allied Health 209 lab. So as we know, when we were together this past Monday, we finished up with some labs. We finished up the majority, and we knew going in this was a hybrid class, and that a big majority would be done hands-on in the lab, and there would be a half or less than half. It'll be less than half of you guys will be online. So what I'm doing now is finishing up the remainder of our laboratory modules that we have. They will all be done online. The important thing is for you guys to get the knowledge, and then we'll prepare for our final testing. And I'll be talking to you guys about that in a different presentation. So let's start here, guys. You see right here up on the screen was our monthly laboratory maintenance log, right? And you guys had that log out, and you would come into class, and I'm so proud of you guys. Did so good every day. You came in and went straight to filling out your maintenance logs. And we do this procedure so that you guys will get used to being able to do these kind of things. You kind of get in the habit of knowing these things are done, right? Because we need to make sure that any refrigerators or freezers that are storing any type of reagent or blood supplies or controls, anything that needs to be kept at a temperature between 2 to 8 degrees or -0 to -20 degrees, is truly kept at that degree. Because if we don't keep our reagents and controls, anything that needs to be kept cold or frozen at those degrees, then it will affect their effectiveness, which in turn could have us reporting out erroneous results. Same thing with the incubator. We want to make sure our incubator falls between 35 to 36 degrees Celsius, because we want it to be at the optimal temperature to inhibit the growth of bacteria, so we can tell what's growing inside our patients, so we will know how to treat them, right? We should always, if we have a system like we do in our lab, that the water is separate from the bleach, and that the action of spraying that bottle combines the water with the bleach only at the time you're spraying it to clean your countertops, then we don't have to really check that every day necessarily for mixture. You always want to check it to make sure the water side's full and it's working properly. But in a lab setting, if you're mixing up your 10% bleach, that is something you need to do every day. And of course, all bottles in a lab should be properly labeled, have the proper labeling system on them, and we should know what is in those bottles. Also, eye wash stations. We all want to check these eye wash stations monthly, right? To make sure they're working properly, because we wouldn't want an incident occur and we need the eye wash station, but it's not working, right? Same thing with showers, if they are in your facility. Some facilities have the need for showers, some do not. So you guys did a really good job with this. I'm proud of you. We'll get those grades up on that. Some you did a good job. But I want you to understand why we do it. We don't just do it to do it. There really is a reasoning behind all these things. So we're going to go through this. We went through this in class on Monday, but I really want to make sure that you guys can spot these instruments, know what they're named for, know what they're used for, and then know the normal ranges involved with these testings, okay? Because as you know, it's going to be on a test. Not only do you need to know it to do well on the test and pass this course, but when you get out there and go to work, a lot of these instruments will be in your physician's office labs, and you'll be better familiar with them. So let's start with, if you're looking at this, what is the instrument that is number one? It's that Clinitech, right? So what test is run on it? The UA, right? Our urinalysis. Instrument in picture number 2. That's our hematostat, right? What test is run on it? Hematocrit, right? Now here's where you guys are not only going to need to be able to spot the Clinitech, know what that instrument is by sight, to be aware of what test is ran on it, but also in the case of the hematostat, we know that hematocrits are ran on them. What are the normals for men and women? Remember, if you saw a normal range from 37 to 54%, you would know that that is just a combined range to cover both men and women. But we do understand, as we discussed in lab, that there's a difference between men and women, and why. That's that stat site M. You guys did all 3 of these instruments in lab, hands-on experience with them. What tests is ran on it? The hemoglobin, right? What are the normals for men and women? Okay, and again, you could see 12 to 18 grams per deciliter as the normal values for hemoglobin, and you would just understand that that was covering both males and females. But if you were asked, what are the normals for males? You wouldn't want to put 12 to 18, you would want to put 13 to 18. And then these are the ones that we talked about in lab on Monday. So we know we set up our Westrogen SETI-PLAST system in lab, right? And remember, the most important thing with this is to make sure that once you get your system set up, as you see in the picture on right here on our screen at the top, and you guys did this hands-on in the lab, that the most important thing is to, of course, follow directions and set it up properly, the amount of blood, the line that it goes to, but to start your timer right when it's set up and then read it exactly at an hour. So what test is run on here? We know this is for our SED rate, right? And again, if you see something 0 to 20, that's just encompassing both males and females. It's important to make sure you read the directions of your test question so you'll make sure you get the right answer. This was our QBC star machine. We run CBCs on it, and as I talked about in lab, there's multiple different instruments out there to run complete blood counts on that you will find in your physician's office labs. Remember, this is our handheld CoaguCheck machine. And we know that this machine is used to test for PT, right? We understand that it's how long it takes our blood to clot. So when you think of that, you think of a time, right? So seconds, 12 to 14 seconds. So we talked about this in lab. We talked about the collection of blood for PKU. You guys would have filled out your requisition form, because as we know in the real world, your requisition form will print out in your lab, or your doctor will hand you a requisition form, and your patient's information is already on there. It is vitally important that you pay strict attention to your requisition forms. You could have multiple requisition forms on the same patient, or there may be a stack of requisition forms laying there or printed out on the printer, and a couple of them could be for one patient and a few may be for another. You always want to make sure you double and triple check yourself to make sure you're using the proper requisition forms to identify your patient. So when we talked about PKU, right, we talked about that it's a genetic disorder inherited from a person's parents, right? We talked about that individuals with PKU have lighter skin color, lighter hair color, and they usually have that mousy smell to not only their body, but their urine. And we talked about this when we covered urinalysis and how important that the odor of a urine can give you telltale signs of disease states. Okay, we went over all this in lab, and I just want to quickly go back over this and cover the rest of what's in this packet. So treatment is with a diet low in foods that contain protein, right? And we understand that untreated PKU can lead to behavioral problems, mental retardation, seizures, right? So what we want to do is we want to make sure we find out as quickly as humanly possible if this child may be positive for PKU, because if they are, then we need to know that so we can immediately get them on the proper diet so we don't cause them lifelong damage, okay? And we remember the condition is diagnosed with this PKU test performed after the baby has received milk. We understand that milk contains high levels of protein. We need to wait at least 24 hours. We would like to wait at the baby's at least 24 hours old before we perform this test, because it's giving them time enough to drink the milk and then build the phenolphthalein up in their system so it will be there for us to test if they have PKU. Now we got to remember that in this day and time, sometimes a baby is born and they are sent home before they're 24 hours old. We just want to make sure that if that has happened, the baby may not have gotten enough milk, and we want to make sure this test is repeated within the first 2 weeks of their life. They don't need to go past 2 weeks, okay? Now, we will go ahead and do that test in the hospital, but we want to make sure when they have their follow-up that they get tested again before they're 2 weeks old. So, of course, we wouldn't be sticking babies in lab for real, right? But you want to try to imagine doing these PKU tests, okay? First, your lab partner would have been the mother of your baby, right? And so you get with your lab partner and fill out the PKU form. Well, we talked about this in lab, about filling it out with baby boy Jones, baby boy Burns, it doesn't matter, right? Then you use a pediatric lancet, right? Remember, we have adult lancets and then we have pediatric lancets. Okay, so you would use a pediatric lancet, and as you see from this picture, you're going to go to the lateral or the medial side of the heel. You never want to stick the center of the heel, as you could hit the bone and cause osteomyelitis. So we go over there to the side with a pediatric lancet, right? You follow the directions as always when we're doing skin punctures. You wipe away the first drop of blood. You get a good, nice, big drop of blood and drop it in the center of those circles, right? It's like coloring within the lines. You never want to add a second drop to the same circle. It's going to oversaturate the circle, but you want the circle completely saturated, okay? After the circles are filled with blood, it is allowed to dry completely, and you never want to stack one on top of the other, okay? You want them left to dry out, then they're mailed off to the health department. Now, skills procedure, collection of blood into 2 microcontainers, right? So right here, guys, you should have I want you to have your lab packets out and are turned to our skills procedure right after the PKU for collection of blood into 2 microcontainers. So what did our doctor order? Okay, he ordered a CBC. Okay, remember, when performing a CBC by skin puncture, you must make 2 good blood smears first for the manual differential test, and then collect blood into the microcontainer for the other test. Okay, as always, you would fill out your patient information with your lab partner's info, and you would check 1 through 4 off, because we know we would come in, wash our hands, apply our PPE, clean our stations, right? All right, so we know here, since we're sticking a finger, our specimen source is going to be capillary, right? And then where do we take a CBC? What section of the lab does that go to? If you're struggling with these answers, guys, you need to make sure you're studying and getting ready for that test. It would go to the hematology department in the lab, right? Would you fill out the test performed section today? No, because you're not today doing a CBC, okay? But if you were the one performing, if you had been trained on how to use whatever CBC instrument your physician's office lab was running, and you were running that CBC, then you would fill out the test performed by. And then remember, documentation is crucial, right? We always remember that we warm a heel or a hand. We get 7 times more blood from that warm heel or hand. We select the appropriate area, okay? You always want to go across those fingerprints. If not, it's going to be hard for you to get that good drop of blood, and you want to avoid the bone. We always clean the area we're going to puncture in concentric circles and allow it to dry, right? We place their hand flat on the table. Do not hold their hand in yours. Then you perform your finger stick, pressing your lancet down very hard as you depress your trigger, okay? Once you hear the trigger press, in your mind, you say 1, 2 to count 2 seconds, right? Then you dispose of that lancet immediately in your sharps container. You always wipe that first drop of blood away because it is diluted. Turn your hand over, squeeze your finger hard. Takes about 2 seconds, okay? And then you want to get that 1 large drop of blood at a time, okay? We don't milk the finger. And remember, the order of draw for microcontainers is different than that for venipuncture, right? For venipuncture, we have our nice flower picture, right, with our sun in the sky for blood culture bottles or a yellow top tube, light blue raindrops, all the way down to our gray rocks. And that is the order of draw for venipuncture. But when we're collecting from a skin puncture and we are collecting microcontainers, we do purple first because we know that finger is going to clot a lot faster, right? And we know that the purple type is going to be used for the CBC, and in the CBC, we're going to be counting the platelets and the white cells, right? And so we don't want all those cells to get clumped up. It could give us an erroneously low platelet count, an erroneously low white cell count. So we want to collect that purple top first. After collecting the purple top, any other microcontainers that have anticoagulants in them, such as a green top, would need to be collected. And last, any of the ones like a red or an SST they're going to clot, we want them to clot in there. Those are collected last. That way, if they get a few microclots in there, it's not the end of the world because we're going to allow it to clot anyway. Try not to waste blood. We never scrape the finger. At the end, after they've been holding pressure while you finish up your things, you always want to wipe their finger with some peroxide, apply your Band-Aid. And then you always tell them to remove the Band-Aid after about 15 minutes if it stopped bleeding, and always use the best customer care in telling them thank you. Then you label your specimen, your microcontainer, with the basic 6, okay? So 4 secrets to collecting enough blood is, okay, collect blood quickly, but be patient while each large drop dangles. Pregnant drops form. You want it to dangle, and then it'll drop down into the container. Again, try not to waste blood. Don't scrape the finger. That could cause hemolysis. You squeeze the finger really tight, trying to get that big dangling drop, right? You wait 2 seconds, then you push down on the fingernail with your thumb and bend the tip of the finger down, which will allow that drop of blood to drop down into your purple microcontainer. You want to fill it to the 250 microliter section on there. You want to invert it 20 times. The order of draw for skin puncture, again, is purple. Others, especially those with anticoagulants in them, in red. You label them with the basic 6, or you pull off one of the small labels that are on your forms and put it onto your microcontainer. Now we're talking about blood being drawn for blood smears, right? Our doctor here ordered that CBC with a diff, so we're going to need those 2 blood smears for that manual differential. As you guys know, we've talked about this in lab before. We've made slides and we've collected in micro containers. But remember, those blood smears should always be made first. And remember, your CBC will give instruments a lot of times will give you an automated differential count, but a lot of times physicians will order a manual differential that the clinical laboratory scientist will have to perform. So remember, a differential count or diff is taken by counting the first 100 white cells encountered on a stained blood smear. Categorize them by type, okay? Now, you guys have made smears in the past, and I'm just going over this again with you guys. And as you can see from this picture, there's that drop of blood in the center of that slide, as close to that frosted or white end as you can get it. And then, as you know, you have your pusher slide out in front of that blood drop. You have it at that 30 to 40 degree angle. You bring it back where it touches the blood drop. As it starts to run across the slide, you will make a quick, smooth motion to pull that blood out across that smear all the way to the end of the slide. Remember, we don't want to press down hard and we don't want to stop. You want to go smoothly and quickly all the way off the end of the slide. Remember, a good smear is smooth, even surface, not wavy. I've showed y'all times in lab what they look like from the ones that you have made. Remember, like I tell you, they go from thick to thin, and the ends in a nice feather edge. It covers about half to 2/3 of the slide, and it's not too thick or too thin overall. And remember, this is how we make them, and we've made them in class before, but I just want to show you these slides and go over this with you guys again so you will understand repetition is how you learn, okay? And as you can see from our picture at the first, remember I show you that you drop that drop of blood in the center of the slide, close to the frosted or white edge where you label it. Then you put the pusher slide in front of it One finger will be on the back of your non-dominant hand, will be pushing down on the slide to keep it in place. With your dominant hand, you take your pusher slide and you bring it back into the drop of blood like you see in the middle picture here. Then once that blood starts to run across the slide with no pressure, just smoothly and easily at that 30 to 40 degree angle, you quickly move that slide, that pusher slide, off the slide, pulling that blood with you across and making your nice smear. Remember, do not put several drops and then go back and spread them all. They will dry out. Put one drop, then spread it, one drop, then spread it, etc. Right? I've seen you guys make these slides. Y'all all did a very good job. It takes a lot of time to learn this. This is why I'm going over it again, to make sure you lock this in your mind for how it's done. Also, so when you take your lab test and your lecture test, these kinds of things are locked in your mind. So these are the things I've looked at for you guys in lab before. These are all the things I check. I always make sure that your basic 6 is proper, that you collected the 250 microliters if you could, right? And that you've made your 2 slides. And we go over, if you don't make your slides well, you know, we always went over in lab if it was done right, which ones were done right, which one was done wrong, and I would give you those pointers on what could have made it do this, why did it do that, so you guys would see where you were making your errors and you could go back and improve on that. So, and we would always look to see that you put your patient's name, the date you made the slide, and your initials on your slides, okay? Okay, guys, and we know always before we leave, we dispose of all of our waste properly. I can't say to you guys enough to please think before you toss. If it is trash that has no blood or body fluids on it, it can go in the regular trash. But if it has any blood or body fluids on it, it needs to go in the biohazard waste. If it's a sharps, it needs to go in the sharps container. And we always make sure that we put all our supplies away. We stay organized, right? We always clean our areas. And we always make sure that when we remove our lab coats, they go in that plastic bag to contain those germs. And then we remove our gloves last, and then we always sanitize our hands before we leave. Guys, I'm going to be putting up several of these very short lab videos just to make sure that you get all the knowledge you need for your remaining laboratory tests, including your comprehensive lab final. If you have any questions, comments, or concerns, please reach out to me. 90% of the stuff on our in our worksheets, we may not have gotten to do them as many times as we would like to, but we got to do them more than once in almost all cases. So, but these last few, I just want to go back over with them to make sure you have all the knowledge you need, so that when you go into taking your exams, you'll feel good. So look forward to the rest of those, and I will put out a video shortly and send out an email on the remainder of tests that are out there for you guys to take.